treatments that we have drug resistance issue. You would like to expand more on that. But there is issue. You know that tuberculosis is a contagious disease. And we know we have it in the markets, in the prisons, and all that. So, what exactly do you think government should do, in these instances?
Okay, thank you so much. For government, I think the majority of social welfare package and also trying to battle things like poverty and increases people's capacity to have access to common things in life is very key, which is a long-term effect. But I think also providing, like you talk about prisons, providing a prison service where there is ventilation is very key. Identifying, screening, and like now what we're doing currently is that we're providing screening in the prisons and all the correctional centers, all the correctional centers, and also at the at everywhere you have a congregate of people being arrested for one reason or the other, or waiting for trials. We try to provide those services there to screen, and the idea is early identification, treatment, and then for those who are also in the prison that have contact with these patients, we also provide them with preventive drugs to make sure that they don't develop at the end of the day. So those services we are providing, we are using currently now. The plan is to go ahead with we have done that in so many prisons where we are using the CAT4 TB X-ray with artificial intelligence to say we screen every patient.
So you have screening in correctional centers right
yes.
now?
Correctional centers, we have screening ongoing. We've been doing what we call massive screening to make sure that everybody at each point in time, the idea is that at least twice in a year, we should have access to screen all of them and then provide any one of them with treatment. And the treatment, like we said, is free. It's not charged, it's free. Prevention is also free in the country, and all the diagnostic facilities are also 100% free. They don't pay for those services. So that is very key for what we are doing. And for now, I think every contact, for now what we're also doing is that for community preventions, we are also making sure that early diagnosis is key, because when you diagnose and treat, and TB is one disease, even with the infectious level, within 2 weeks of initiating treatment, the person starts being infectious. Almost 80 to 90% infectious will go down. So it becomes that the person is free to to continue his life in the society within 2 weeks. And what within early identification and that treatment, which stops the spread of the disease, one, and then for every contact of those patients, we also give them preventive treatment. We have moved from long-term preventive treatment of 6 months to getting to 3 months treatment now, because the new drug we are putting in since this year is now the drugs that instead of them putting them on 6 months prevention, we are now going to put them on 3 months prevention. And the idea is those contacts, which if you remember when Doc was saying, he was talking about the volume of inhaled bacteria the person have inhaled over a period of time, because the patient is a family member. All of them have been in the same house. Most of the time these houses are not well ventilated, so they are inhaling as the person is coughing out the bacteria. So as the bacteria is being coughed out, the family members are inhaling. So to make sure nobody later develops the tuberculosis, what we do is that we also place the entire family members and even those within the environment that have had contact with that patient to place them on prevention.
All right, Dr. Ubochioma, I'm thinking, is there a possibility that someone who's been treated, for tuberculosis to come down again? Does the treatment mean having immunity over it?
No, it doesn't. The person can come back. The patient can come back. The level of coming back, some people can be declared cured and they get infected in the community, and then they reappear. Okay, we tag those ones as maybe we say relapse, that the patient had been treated before, but he relapsed. Some of them are those who also were treated, but were not cured, but later they also come back with the disease, because they started feeling fine and this thing. So we tag all of them as cases of retreatment.
Okay.
They are all retreatment cases who have actually been exposed to TB treatment initially, but however they came back again with TB. And some of them can be also because of they were unable to complete the treatment ab initio, which is where we fear issue of them becoming resistant to
the drugs. Many thanks.
What about the issue of tracing and surveillance system? What kind of tracing and surveillance system do you have?
Okay, what we do is once a patient is diagnosed, all the people within them are screened for TB, and those who are not positive for TB are now placed on prevention, while those who are positive for TB are placed on treatment in the community. We also have what we call early warning signs, where what we do is like an AI system where all patients, when patients are being registered in the AI system, they give you an environment where there is tendency for high volume of TB cases. So we go for community outreach in that community to make sure that we comb all those areas to prevent. Because when we now find a situation whereby you find in a small locality there are 10 TB cases diagnosed from that center, it means there is something happening within that environment. So that AI tells you through the community system that the community should visit that place for this. So they go there with artificial X-ray with artificial intelligence, screen the people, and after screening them, everybody identified by the artificial intelligence to be by the X-ray to be a presumptive case of TB. That's you are thinking that this person may have TB. The person's sample is taken to the nearest molecular lab where it is tested for TB, and those that are positive are placed on treatment.
All right, Professor Abubakar, as we round up the conversation, I'd like you to speak about what can be done better, in health centers that have to deal with patients with tuberculosis, and medical personnel also. They have a role to play in all of this. So I'd like you to speak around that as a way to end tuberculosis by 2030.
Okay, thank you very much indeed. We need to improve on our health systems. And of course, when we talk about the health system, in Nigeria, we have the building blocks are up to 8. Part of them have to do with things outside the health sector, but majority of them are within the health sector. And of course, the health centers are the sites where we see real reflection of the health sector. And of course, that is service delivery. And for service delivery to improve, you need to have standard operating procedures which must be adhered to by all the personnel in delivering their services. Of course, from the time that you receive a patient, how you detect the disease, the diagnosis, the treatment, and of course, the follow-up and everything you will do to the patients are to be guided by a standard operating procedure, and people must be seen to be adhering to them. Secondly, we need a lot of teamwork. Our health workers need to work in unison, not to have unnecessary interprofessional rivalry, and everybody's job description must be followed. And we must respect the contributions by others. And of course, our health workers need training and retraining, and in some cases, reorientation based on available evidences that are emerging, best practices from researchers and from centers that are doing very well and have been succeeding in managing the cases of tuberculosis, and that is the way to go. And of course, we need to increase the number of the workforce. Our available health personnel need to be improved upon to ensure that we are able to deliver. We shouldn't be having a situation where few workers have to do with a lot of work, and that does not ensure quality. And then supervision is very, very important. Whatever the workers are doing, if they are not being supervised, there is really not a feeling of motivation and some may derail from good practices. And then we should ensure the availability of the drugs. Of course, we've had, and it is reassuring from the Federal Ministry of Health, that the gaps are being closed, because we have encountered a situation where in some of our health facilities there were shortages of drugs for some times. But of course, I can tell you now there are available drugs, at least in the places that I practice. So we shouldn't even have a situation where we'll be having out of stock for some of these very, very important drugs and consumables, reagents that we need. We must ensure supply is being steady without any disruption. And of course, the funding, even at the health facility level, a lot of resources, financial resources are needed to ensure the services are going on undisrupted. So whoever is responsible, from the level of government to the management of the health facilities, they must ensure that this funding is adequate, and it should be based on needs, not just a situation where people budget and then the boss at the top will just reduce certain amount and give them. It should match the requirements adequately. And of course, everything that we should do in planning, we must ensure that there are evidences from our health information. So whatever, based on the number of cases that we have seen, we should plan everything based on that, forecasting what will happen in the future. So health information is very, very key, and establishing partnership with the community, the civil society organization, the government, the non-governmental organization, and even international partners that are supposed to be assisting us with funding. This is very, very key to ensuring steady supply of services, undisrupted, and then good quality of services are being provided to the people who need it. So we need to foster collaboration with everybody that can make a difference so that the services will be good. And nothing short of that will be good for the health sector. And of course, by the time we ensure all these things, I believe that we're going to have a lot of improvement in not only ending tuberculosis, but improving the health system generally, devoid of diseases in most cases. Thank you very much.
Prof. Abubakar, for that. Going forward now, I mean, the need for us to collaborate, I mean, to get more stakeholders involved, like civil society groups and private sector, like what the First Lady is doing now, Senator Oluremi Tinubu, trying to end TB in Nigeria. How do we go about that? I mean, getting more stakeholders involved in this fight. Dr. Momodu.
Okay. Thank you so much.
Just in 1 minute.
1 minute, okay, thank you so much. I think it's quite applaudable seeing the First Lady doing this, and it's more like the keeping the torch burning, of which other individuals, both local, national, international, can also imitate and follow suit to help curb diseases. It's quite important at this particular time of our lives, whereby I've seen that in every community now, you have to own up for your health. The United States has actually dropped out some fundings. So we need to really commit ourselves at this particular point, wherein we can get these personalities who are willing to actually help out, okay, and support this TB program is very important. And like Prof said, you're investing, you're not just donating. And we'll have better health care for people who are living in this TB endemic area. And also a call to for clinicians, the healthcare workers, all other people on ground to deliver these particular measures to help achieve these goals.
Thank you so much. I think that's a fine way to leave the conversation. Many thanks, gentlemen, for joining us. Dr. Jafar Momodu, pulmonologist, fellow of the West African College of Physicians, National Hospital of Abuja. Many thanks for being our guest.
Thank you so much.
and we hope that you continue to ensure that we stamp out TB. Dr. Emperor Obochioma, Team Lead for Program Management Unit of the National Tuberculosis and Leprosy Control Program, Federal Ministry of Health and Social Welfare. It was a delight to have you.
Thank you.
All right, we also appreciate Professor Isa Sadiq Abubakar, Director, Center for Infectious Diseases Research, Bayero University, Kano. Many thanks for joining us, Prof. We do appreciate you sincerely.
Thank you very much for having me.
And of course, I would also like to thank Dr. Jean Louis Sabina Phil, who joined us from Brazzaville, the Republic of Congo, in the course of the conversation. He is a technical officer for tuberculosis at the World Health Organization Regional Office for Africa. So that's our package this Monday on Good Morning Nigeria. Take care of your health. And of course, let's end tuberculosis in Nigeria. I'm Henry John.
And I'm Ademola Adeoye. Stay safe.
Advertising your goods and services on the right channel gives you an edge over your competitors. NTA News 24 has all the platforms for your target audience. With our digital format and wide range, we can reach your customers in next to no time. We are eager to promote your business, goods and services. So partner with us for a very rewarding business experience. For more information,